and welcome to Farm to Home this morning with registered pharmacist Thomas McDowell. Thomas McDowell is with Medical Park Pharmacy located in the Boyce Willis building on the first floor right there. You can walk right in and find you and your wonderful staff. You know, Thomas, I hear so much about your staff, how helpful, how nice. And that's what you want. I mean, it really is. But today we're going to dive in, y'all. Something that people tell me all the time, you know, I just don't know anything about. Medicare is so complicated. Well, of course it is. It's government. Of course it is, right, Thomas?
That's how it goes most of the time. Gets a little confusing.
Yeah, and you're going to talk to us about changes when it comes, especially when it comes to your aspect of it, which is the drugs. So
absolutely. Well, thank you for the kind words about our staff. They really, go above and beyond to take care of patients, and I appreciate that. And we have a wonderful staff at both of our locations. I do want to mention that we're praying for those affected by Hurricane Helene, especially out in the western part of the state, and a shout out to a lot of the independent pharmacy owners that I'm connected with, and so I'm hearing from them, talking with them, and a lot of them are staying open and have figured out ways to keep taking care of their patients despite not having power, no ability to transmit insurance claims, and still providing medications while some of the big box stores with millions of dollars of resources are still closed.
Well, we're thankful that those people can get creative and figure out how to do that and are willing to do that.
And so that's just kind of the beauty of local health care, because you do what you have to do to take care of patients. And so our thoughts and prayers are with those out there in the western part of the state. But back to Medicare, so definitely a relevant topic because Medicare open enrollment is coming up October 15th through December 7th. Is that every year annual open enrollment period where you can look at your plan options and potentially make a change to your Medicare plan, whether it's Part D or Medicare Advantage, and your new plan would start January 1st. So throughout the year there is occasionally a special enrollment period with certain circumstances, but most patients typically can only change their plan during this open enrollment time. And the key here is to just be aware and to have somebody you can talk to about your Medicare plan. And so the Medicare D space is going to see a lot of changes in 2025. And it's going to be a little confusing, and it's stemming from the Inflation Reduction Act is where some of this legislation is bundled into, and with the goal of reducing patients' spending on drugs. Obviously a hot topic always. Seems like drug pricing and what the patients are having to spend at the counter continues to rise. When it comes to insurance, the pharmacy has no control over the copay. And so the government trying to get involved and make some changes, but there may be some repercussions to that. But some of the main changes are in 2025 there will be no more donut hole coverage gap. So previously,
really?
So that is exciting for a lot of seniors that were spending, had several brand medications maybe that were expensive, and April, May, June comes along and they're thrown into the donut hole. Their cost sharing amount substantially increases on some of those brand drugs. Sometimes they may be paying $47 for this drug through the initial phase, and then all of a sudden they're paying $150, $200 plus for several months, and yet you had to pay your way out of the donut hole. So you hit that coverage gap when your spend plus your insurance company spend reached a certain threshold, and then that gap you had to pay that higher cost sharing amount until you got out of that gap, and then you'd hit the catastrophic phase where you had a smaller percentage of copay. And so no more donut hole. So what that means is now there's just a capped max out of pocket on drugs. So $2,000 is that max capped out of pocket per year. So the most you will have to spend on your drugs, and you might not get to this, and that's great if you don't, but the max you'll have to spend is $2,000. And the deductible amount is included in that. The drug plans still do have deductibles, most of them, that is. And the deductible has increased a lot, and that's kind of one of the repercussions to this is a lot of the plans raise their deductible.
Yes, right.
Because
It's coming somewhere.
yeah, the money doesn't just disappear. So what's happening is the plans, theoretically have more responsibility to cover the cost of the drugs because the max out-of-pocket's capped, versus previously in past years, the patient was responsible for a lot of the
Right.
cost sharing up to a much higher amount than $2,000. And so now, after 2000, the plan is responsible. And so what's happened is that the plans are all saying, well, we're going to have to raise the premiums on the Part D plans. And so that has not actually happened this year. The plans are not seeing we're not seeing a big increase in premium, but it's because the government is subsidizing the premium increase.
Okay.
And so that money is being, basically these costs are being taken on by the government this year. And so I don't, this is just my opinion, I don't foresee that continuing to happen without potential
Sure
Medicare
not.
tax increase on payroll taxes, and this is just my opinion again, so it's not facts, but that money's got to come from somewhere.
It
So
does.
it's potentially this year. We'll kind of see how it goes, and I hope we won't see drastic increases in premiums in the future. But when the plan has to spend more money, they're for-profit, huge billion-dollar companies, these insurers. They're going to look to get that money elsewhere, whether it's through premiums or higher deductibles, higher cost sharing. On the Medicare Advantage side, we may see in the future more higher medical deductibles, because on the Advantage side, the Part D and the medical coverage is bundled into one plan, and so their job is to try to use their money wisely that they're getting per patient. And so anyway, we'll see how it shakes out. But in the meantime, for folks that had to spend a lot of money in the past, it's going to be beneficial this year because their cost is capped out of pocket at $2,000. And so they may see some slightly higher cost sharing, but it should be a little more consistent because now we're down to just 3 phases of coverage. You got your deductible phase, which on most Part D plans, I think it's going to be close to $600. So you still don't be surprised if you go to get your expensive Ozempic or
Right.
brand medication, and you're paying several $100s for it because you've got to meet that deductible.
Right.
But that deductible does apply towards your $2,000 max out of pocket, so that's good. And so once you meet your deductible, then you go into the initial coverage phase, which is kind of like the standard coverage where you're paying your typical copay. Then you hit your max out of pocket of $2,000, and after that, everything is zero.
Right.
And so that's the 3 phases. You have the deductible phase, the initial phase, and the catastrophic phase. No more donut hole. So that's really exciting because the donut hole was always a real strain on folks that might not have that income, and,
Right.
and we'd see patients go without their medications, which is unfortunate.
That is.
And so, this is going to be good for some people. For folks that aren't on expensive brand medications, this really isn't going to affect you because
Right.
you weren't going into the donut hole to begin with. And you're never, if you're only on 2 or 3 blood pressure meds that are really cheap generics,
Right.
you're never going to get to the $2,000 max out of pocket. So
Right.
you may not see any difference, but for the folks that are on brand medications, you're going to see some positive changes for now. And so, and you shouldn't see too drastic of a premium increase on your Part D plan. So, and then another new thing is there's something called a Medicare prescription pricing plan. And this is a payment plan, Medicare prescription payment plan. This is a way that you can enroll in this plan through, you would go through your carrier, through the plan that you're enrolled in on the Part D side, and you can actually smooth your cost out throughout the year. And so if you had big deductible copays at the first of the year that you couldn't afford, you can actually smooth the cost sharing throughout the year.
Okay.
It's going to be a little messy because it's you have to actually sign up for it, and then the plan is going to send you a bill for the cost sharing, the smoothed out cost sharing, and you have to pay that, or else you get pulled out of the program. And so that's going to be a little confusing. So, but just talk to your pharmacist about that. That's something we're going to be trained and ready to talk to you about. I'm going to be talking with my team actually this evening about a lot of these changes in Medicare D. I keep up with them closely, and we're going to share that with all of our team members so that we're prepared. But
well, we're glad that there's somebody we can go to, because I know you all listening to this are thinking, wow, I'm tired. After all that.
I probably put everybody to sleep.
No.
That's a lot of boring stuff. But.
No, that's not what I'm saying. What I'm saying is they're like, oh gosh, more changes, more that we don't really understand. I mean, yeah, we hear what you're saying, but we need to come in and talk to Thomas and talk to his staff. And thank goodness we have somebody to guide us through this, because, all of these changes, different things that they're changing and levels, and it's so good that we can go to our pharmacist. Don't worry about it. Don't stress over it. Just go to your pharmacist. Isn't that what you would say?
Yeah, absolutely. And so
let y'all handle it for them.
Yeah, I mean, this is kind of just some general information. I would say the key things to glean from this is no donut hole, $2,000 max out of pocket.
Mm-hmm.
Just kind of have that in the back of your mind. There is a Medicare prescription payment plan where if you have really high deductible, cost sharing, you can smooth your copays out throughout the year. But yeah, don't feel like this burden is on you. We're Medicare experts at the pharmacy, and we can actually, we can provide Medicare consultations. And if you have questions, come to the pharmacy. You don't have to get your prescriptions with us to have us help you on Medicare. And so we've been doing this for 10, 15 years. Before I was even out of pharmacy school, my father and our team we were doing Medicare plan reviews. Going back to when Medicare D first originated in the early 2000s, and so we live and breathe this stuff every day. We're billing Medicare D plans every single day, and so we understand it, and we're ready to help you with questions. And so come in, talk to us, and we'll set up a time to sit down and go over your Medicare plan, because this is a really important year to look at your options and make sure you're in a plan that best covers your drugs and has an affordable premium. Because there are some changes, and there are some plans that have, on average, the premium increase there's not really a big increase, but some plans have increased their premium. And there's actually some plans that are kind of seeing this, and they're thinking, well, we don't really want to be in the Medicare D space anymore. We don't like where it's going. We're just going to stick to our Medicare Advantage plan. So there's one plan that had one kind of insurance health plan that had 3 Part D plans. Is SilverScript actually is the name of it. They had 3 flavors of their plan, different deductibles, premiums, cost sharing, but now they're down to 1. So if you're in one of these plans, it could be one that is being discontinued, and they should be sending you communication about that. And then United Healthcare, AARP, Part D plan, they previously have had 2 plans. They're down to 1. In our region, more specifically in Halifax County, but probably similar here, there's only 16 Part D plans, and in the past there's been 30 to 40.
Oh wow!
So to me it looks a little bit like a lot of these changes are going to cause some of these plans to lean into the Medicare Advantage space more, for better or worse. There's a lot of opinions about that, but Medicare Advantage seems to be more profitable for the health plans, and so the Part D space is getting is shrinking, and which I hate that, because there's a lot of patients that have the original A and B plus a Medicare supplement plus the Part D plan, and they like that coverage because everybody basically takes original Medicare, and they don't want to be in the Medicare Advantage, which does have some perks, but also has the networks and making sure your doctor's in network, and has kind of copays as you go, versus with the original Medicare A and B and a Medicare supplement, you often don't have to pay anything at the doctor or the hospital.
Right.
So a lot of changes coming in the Medicare D space. and a lot of plans are getting out, so there's less options. So really important to make sure you're in the right plan. So talk to us at the pharmacy. Our number's on the screen. Call us and we'll set you up with an appointment. I do a lot of the meetings with the patients, talking about their Medicare plans, and we would love to help and try to find something that's best for the patient. And our goal is to help you and help you have a plan that's affordable and meets your needs. So a couple quick things, just a reminder, these are not new for this year, but this will continue. So insulin on Medicare is capped. The cost is capped at $35 per 30-day supply.
Oh, wow. Okay.
So that was
That
new.
could be good
That was new
for-
last year.
Yeah.
So and no deductible payments on insulin. So if
Wow.
you're at the first of the year, you get your insulin, it'll be $35 per 30-day supply. Now, if you take a really low dose and your box of insulin, because the pharmacy's calculating the day supply, the insurance makes us do this to ensure that we're filling it when it runs out.
Right.
And so if your day supply is 75, you're going to be in the 1 month, 2 month, 3 month
Okay.
category. So that would be $35 times 3,
Yes.
which is $105. So that's a little confusing because some people say, well, my insulin's supposed to be 35. Well,
Right.
if it's only lasting you 30 days or less,
Right.
it'll be 35. If it's lasting you 30 to 60, it'll be
Right.
70 and then higher. So it's based off how long it lasts you.
Right. I got it.
And so that's still good because no deductible, no super high copays on insulin, and then also any recommended vaccine that is approved by FDA, CDC, and is recommended by those entities is covered at no cost sharing for the patient, which is the same as last year. But in the past, the shingles vaccine could be super expensive for some patients because it went through Part D and not the medical side. And so people would have huge deductible copays on that, and they would, avoid it. And so the shingles vaccine, no cost,
Oh, wow.
no deductible, no cost. The RSV vaccine's pretty new. That's no
flu.
cost. Flu, COVID, pneumonia, tetanus, no
Wow.
cost on those. So those are good. If you
Yes.
hadn't had one of those shots, we're doing tons of vaccines. We have the flu vaccine in stock for typical flu vaccine, but also the high dose for 65 and older. We have there's a new pneumonia shot out. We have the RSV vaccine. We have the shingles vaccine. We have the updated COVID vaccine formulation. If anybody did want that, and the RSV vaccine is not an every year thing. So if you've never had that, you can get it. But
I had somebody tell me that they had the pneumonia shot. Does it give you like a slight, maybe sometimes could it give you a slight, they said they actually went to the ER with a light case. They weren't that sick, but I don't know
Like
what
some
the symptoms
symptoms,
were, but
like-
they said they had a little bit of pneumonia in their lung. They found and gave some antibiotics, but can it
give you pneumonia?
Can it do that?
So it cannot. So if they actually had pneumonia, it would be a very unfortunate coincidence. But all of those vaccines that I just mentioned are inactive, so it's
Right, it's like the flu,
Yeah,
know,
yeah.
people swear to God they get the flu from it.
Yeah, and in the
you
past it
just
used to be
don't.
there were some live formulations
Yeah.
that if you were immunocompromised or elderly or what have you, you could get the flu
Yeah.
from it. Usually not as severe, but it was like a weakened, but still live like virus
Yeah.
that you're injecting. But the current vaccines that are out there that I mentioned are inactive, so you can't get the virus or the bacteria from. And pneumonia is a bacterial infection, so
Yes.
it typically you can have viral pneumonia too, but Prevnar or most of the pneumonia vaccines are covering bacterial strains, and so you cannot get those disease states from the vaccine. Now you can get a low-grade fever and feel crummy
Yeah.
because you're tricking your body into thinking you have
Yeah.
the virus or the bacteria, and your body mounts an immune response against whatever that disease state is, and you produce the antibodies to protect you against the real thing in the future. So it is a myth, and you cannot get it. Now, it does take a couple weeks to be effective. So if it's not going to work day one, so you could theoretically get any of those disease states during that time leading up to the vaccine or after. You never want to get it if you are sick, but and you can get multiple vaccines at the same time, just if anybody's wondering. If you choose not to, usually you will wait 2 weeks between the shots. But yeah, so no cost sharing on Medicare D. So
that is wonderful, and thank you for keeping us up to date. That is one of the reasons we really appreciate Thomas so much, because we stay up to date. He tries to keep us updated on things that are going on, just like this with Medicare, all the new things that are going on with it, and drugs, and the whole thing that it's just not our forte. So we let you keep us abreast of what's going on. We appreciate it, Thomas, so much, and look forward to the next time when I know you'll have some more good information. If you all have any questions for Thomas, please reach out to me. Thomas does a good job of, if I ask him to cover something or answer a question that a viewer has had, he does a good job of that. So anyway, thank you, Thomas, so much for being with us this morning.
Absolutely. Enjoyed it, Sandra.
Absolutely. And go see Thomas and his staff, Rocky Mount Medical Park Pharmacy, in the first floor as soon as you walk in the door at Boyce Willis Clinic. So anyway, we'll be right back with more right after this.